Pets are definitely living longer, and I think there's a number of reasons for that. First of all is the standard of care that they get now. So they definitely get looked after better, they're on good quality feeding, they get regular exercise, so they're less exposed to various different infectious diseases. Then there are very effective vaccinations available. Also, there are much better veterinary treatments available for a large number of diseases nowadays. So cats will now live sometimes 15 to 20 years of age, and here's Claudio, he is 20 years of age. He should have had his letter from the Queen by now, but he's 20 and despite needing regular treatment, he's still in very good health. Early intervention allows us to pick up early signs of disease very often before there are any outward symptoms being shown. That allows early diagnosis, and we can start treatment for a number of diseases before it has any long-term effects on the patient. Common signs of age-related illnesses in dogs. We see lots of dogs with arthritis, so they're going to show signs of lack of mobility, less willingness to go out for exercise. Then there may be changes in appetite. Some of them may lose their appetite, others may eat voraciously. Changes in water intake and changes in toileting habits. And then there's also a whole range of different behavioural changes that we can see as well. Unusual behaviours with the dog that is awake through the night, or the dog that goes and stands in the corner. And these can be associated with brain ageing changes. Cats, we all know, are very different to dogs. Most older cats will just generally tend to do less, so they become less active, and that's generally what owners will notice. And very often they'll just put it down to ageing, when in actual fact it may be down to joint problems with arthritis. Also, owners may see changes in appetite, changes in thirst, changes in toilet habits, and also other behavioural changes as well. Important tips for owners of older pets: if they do spot any changes that are unclear, then the best advice is, if your pet has not recently had a vet examination, then to arrange one, because there's no doubt that early intervention allows early diagnosis, and we can pick up things early, start to treat them early, and without doubt extend the life and the quality of life of the pet. If we think of dogs, for instance, with arthritis, there are lots of things that owners can do to help that. The dog that's been used to having an hour a day of exercise during the week and then 3 hours a day at the weekend, that has to change. So by changing the exercise regime to shorter walks more often and trying to keep it regular each day of the week, then that puts less strain on joints, and the arthritic pet can generally cope much better with that. The aims are to alleviate pain and suffering and to improve the quality of life for pets. If we can identify problems sooner, then we can alleviate problems before they become too serious, and the patient benefits from that and hopefully lives longer. And of course, the ultimate aim of the Prime of Life campaign is so that owners can enjoy having their pets and the relationship can last for longer. If owners have any concerns, or if they spot any changes in their older pets, then the best advice is to arrange a checkup appointment with their vet, and you may well do him or her a big favour by helping to pick up any problems early, alleviate the problem, and help them live longer, happy lives.